So micturition syncope is a situation in which a patient gets up, goes for a wee, and then passes out. And one of the mechanisms thought to underline micturition syncope is a reflex. And this reflex exists because in order to release the contents of our bladder, one needs to be fairly relaxed. So you've heard of this term being bladder shy. And really, the relaxation phase that a patient needs to experience to empty their bladder sometimes causes too much relaxation. So there is a very strong surge of what's called a parasympathetic nervous system that thereafter, after passing water, results in an acute reduction in blood pressure as well as the heart rate. Once again, patients with micturition syncope don't faint every time they pass water. There needs to be all the ducks lined up in a row with the specific conditions such as dehydration, feeling not really mentally switched on when you wake up in the middle of the night, which is when micturition syncope tends to occur, and being a bit drowsy as you go to the toilet to have a wee. Now, the way to counter that, I say to my patients, is when they understand that they're in an environment where they might have a faint with micturition syncope. For example, if they wake up in the middle of the night, they need to swing their legs on the side of the bed and start to do some isometric exercises. So we talked about clenching of the leg muscles, clenching of the teeth, the large muscles in the body to get the circulation going before standing up and taking a few tentative steps to make sure they're steady on their feet before they go to the toilet. If you have a tendency to micturition syncope and if you feel faint, it's also very important to take evasive action early on. So for men, for example, who know that they're prone to fainting and with that significant injury, they might want to sit down in the middle of the night so that they're anchored to the toilet so that they don't drop and hurt themselves. And of course, if you're sitting down anyway and you feel the lightheadedness coming on, what you must do before you stand up to go to lie to the bed very quickly because you're about to faint, what you must do is you must clench, do the isometrics, make sure you tense your large groups of muscles to get the circulation going prior to standing up, and standing up very slowly.